Good afternoon, everyone. I'd like to welcome all of you here today. I'm Bill Baumgartner. I'm the Senior Vice President for the Office of Physicians, but today I'm the MC for this incredible program. For the 33 years that I've been here at Johns Hopkins, I don't think we've ever had a clinical excellent award ceremony ever. So this is the inaugural one. We plan to do it every year, and it is for Johns Hopkins Medicine. One of the mission of Johns Hopkins Office of Physicians is to develop clinical integration, and we do that in a variety of ways with all of our physicians who are employed and those who work in our hospitals. We do it through clinical communities. We have a wonderful spine clinical community. We have a joint clinical community. We have a number of others. And we decided we'd do it through this way, through recognizing physicians who practice in Hopkins hospitals and in Johns Hopkins Community Physicians. And we developed this, and we owe a great deal of thanks to Paul Rothman, who brought this idea to us from the University of Iowa. And as they say, plagiarism is the greatest form of flattery, and so we have copied it to almost to the final pencil mark. I want to, before we start the program, I want to just take a moment and recognize the people who really made this happen today. Dr. John Flynn, Jen Parks in white and black dress, Sandy de Blasio in the corner, Judy Fields next door. They're the ones that put this all together. And as you see, from the program to the awards to the committees that voted the people in, and at the end, there's a reception outside, and I encourage you to then go into the next room where they'll be running videos of all of the award winners. And they're really quite touching that I think you will enjoy seeing them. So without further, I'd like to introduce our first speaker tonight. We're really fortunate to have Mr. Ron Daniels, President of Johns Hopkins University. Ron.
Good afternoon. Thank you, Bill. So let me start with a bit of a thought experiment. Picture this. It's May 1889. The place is Baltimore's top attraction, more popular, at least for the moment, than the tiger at the city zoo or the Grand Dome of the Baltimore Basilica. This place, of course, is the newly built Johns Hopkins Hospital, a facility that can treat hundreds of patients at once, a place outfitted with its own in-house telephone system and individual ventilators under each bed. It's also wired for electricity, even though that innovation has yet to come to this neighborhood. This hospital, in the words of the Philadelphia Inquirer, is the most completely equipped institution of its kind in the world. But it won't be long before it's admired for far more than its innovative architecture. By the end of the year, nearly 800 patients will be treated here, and Hopkins' reputation as the nation's preeminent hospital will already be drawing people to Baltimore. In the more than 125 years since the hospital's opening, both the physical footprint and the reputation of Hopkins medicine have grown very dramatically. But the core ideals on which we were founded, a commitment to innovative research, to rigorous and inclusive education for our medical students, and to sterling patient care have remained consistent, unwavering ever since, and truly have remained consistent over the generations. Today, we're focusing on the last item on that list, the commitment to provide excellent care to our patients day in and day out. The commitment to measures that can take a bit of the sting out of illness and injury and make moments of great duress more manageable, more humane. This is work that too often goes unrecognized because it is simply all in a day's work for so many of the people in this room. That is why we have created these awards in clinical excellence, because they offer us a chance to pause and to recognize you for being excellent problem solvers and collaborative decision makers, for serving as a role model to your peers, and for providing superior consulting services to your colleagues. But above all else, for showing deep respect and compassion for your patients and their families. No matter where you work in Johns Hopkins Medicine, the commitment you have shown is vital to our future. It serves as an important through line to our past and the values that launched this extraordinary experiment in Baltimore. The first clinicians who arrived here at the end of the 19th century to this completely equipped institution may not have had those essentials we take for granted, electricity or rubber gloves, but they had an unwavering desire to provide exceptional care to their patients and to nurture the next generation of healthcare professionals. In so many ways, you exemplify the same values, and we're truly proud to have you as part of our Hopkins family. So thank you and congratulations to all of our honorees. And now I'd like to turn things over to Paul Rothman, who is championing these awards with the same spirit and vision he brings to guiding Johns Hopkins Medicine. And here I should say that Bill said a moment ago that this was something that we are taking from Iowa, but it was not something that was in Iowa before Paul Rothman brought it there. So this is something that is very associated with Paul's values, his leadership, his aspirations. And I think it's so nice, Paul, that we're here today to celebrate this great moment that's so consistent with things that you have championed. With that, I'll turn it over to Paul Rothman.
All right, so I'm going to sit there. So, as a physician, we often get reward for taking care of our patients and their families, and we often get thanks for taking care of our patients and their families. And in fact, I think all of us as clinicians value that. And it's one of the rewards that really keeps many of us going despite having to implement EPIC twice or whatever. But, one of the things I noticed, and actually this dates back, so I'll just tell you history. I was chairman of medicine, and we had all these awards in an academic institution for faculty who got, Nobel Prizes or Lasker Awards, elected to the National Academy of Science, elected to IOM, and, they got grants, and there were all these awards, but most of them really were only recognizing academic excellence. And though I really like academic excellence, I think it's an important thing. But what I notice is that our clinicians who were working so hard for their patients, although they would get that reward of their patients and their families, their peers didn't have opportunities to recognize the best and the brightest, and didn't recognize, even when they did and said, we really like this person, they didn't recognize them for certain skills that are really important for an academic medical center, like ability to consult on your patients, ability to work with teams and build teams that will focus around the patients. I said, well, we can do better. And so we began these awards, and I was so happy that when I came here to Hopkins, Bill and the team said, well, we think that's a good idea. So I want to thank Bill and John and Sandra and Jen and the team for their hard work. This was a lot of work today in getting this awards out. And one of the things I really like about this is how it's been embraced not only at one of our hospitals, but all our hospitals at JHCP. We had 300 nominees for these awards out of 3,700 physicians who take care of patients at our institution. So really it has been embraced. It's really a way for us to thank our care teams and our physicians for all their hard work for taking care of our patients and making Johns Hopkins the best institution in the world. And so I really thank the team for engaging. And John, I almost forgot you. Thank you. John really was the one who drove this, so I really appreciate your efforts here. And it is all around the patient. We're rewarded, but everything we do, and one of the things we talk about that's special about Hopkins. And so I think it's really fitting that the next speaker is one of our patients, and his name is Podge Reed. So Podge serves on the Johns Hopkins Patient Family Advisory Council. And I'm going to tell, if it's okay, I'm going to tell you a little bit of his story. So Mr. Reed is a lung transplant patient, transplant December of 11, so that's 4 years ago. So since then, he's had 4 medical admissions, 2 surgical admissions, 8 outpatient procedures requiring anesthesia, 100 outpatient appointments, and 700 labs and other tests. So, you know, before the GBR, that was great. After the GBR, I'm not sure. So, you know, having his perspective here and having someone who really has experienced our institutions and is, as part of us now, is making us a better institution. So, Mr. Reed, thank you so much for coming today.
Thank you, Dean Rothman. Good afternoon. As a member of the Johns Hopkins Hospital Patient and Family Advisory Council, and on behalf of now 16 patient and family advisory councils across Johns Hopkins Medicine, it is a pleasure to be here today. As a council member, I have the opportunity to hear many examples of clinical excellence. We start each of our council meetings with a patient's story, many of which demonstrate the clinical excellence among the different departments here at Johns Hopkins Hospital. As a Johns Hopkins Hospital patient, it is indeed a special honor for me to be here today. As Dr. Rothman mentioned, I had a bilateral lung transplant on December the 18th, 2011. My pulmonologist, Dr. Mallow, is standing here in the audience today, and I'm glad that he's here to hear my remarks. I know that I stand before you because of the clinical excellence in the lung transplant team. It was and continues to be the great care of the lung transplant team that provides me not only with exceptional medical care, but also has allowed me to continue my life and to give back by sharing my experiences as a Johns Hopkins patient with staff, other patients, and their families. I first became a Johns Hopkins patient approximately 20 years ago when I and my family became members of a Johns Hopkins health plan. I knew that by using the facilities and providers here, we would have access to treatment plans and procedures that were on the forefront of medicine. Agreeing to be a plan member was one of the easiest and smartest medical decisions I have ever made. As a Johns Hopkins patient, I define clinical excellence as more than expertise in a specific medical condition. I define it as also knowing the patient as a person and engaging the patient as a full partner in the diagnosis, treatment, and ongoing decisions related to the care that is provided. Clinical excellence is performance well above the level of satisfactory. It includes 3 major elements: communications and interpersonal skills, professionalism, and coordination of care across the healthcare spectrum. Your communication and interpersonal skills are key to me being an active and engaged patient, participating fully in my own care. This is how my trust in your ability is first established. You're taking the time to explain complex medical conditions and providing options for the treatment plan in terms that I and my family can understand. If I am engaged in the discussion, it will make me a more compliant patient and help my family be more comfortable with the care that I am receiving. This communication is key, for then I am comfortable asking the tough questions and making informed decisions about my care with my entire healthcare team. My chart assists me by allowing my review of the lab test, radiology studies, and any other procedure related to my care. And I encourage all providers to participate in my chart open notes. When I know and understand the options for my care and the associated risk, I and my family, together with my healthcare team, can reach the decisions that are best for me and my family. Professionalism, another key component. The practice of medicine is continually evolving. New discoveries in medicine and research require all practitioners to engage in never-ending process of learning new and different ways to treat a variety of medical problems. This drive to be the best is what I have found here at Johns Hopkins. It means being innovative, willing to try a new idea or a new improvement to an old treatment plan. It also means being willing to consult with others who may be more experienced or have unique expertise when you encounter problems and seek assistance. Finally, there is coordination of care across the healthcare spectrum. This at times can be very challenging. In this area, you will find a variation among your patients. Most patients will need your leadership and assistance. Patients frequently interact with providers from many different specialties and need your assistance to help bridge those disciplines, ensuring there is continuous communications. It is important that the patient understand which provider has the coordination of care lead. Occasionally, you will encounter patients that are actively involved in the coordination of the care. And let's take my case, for example. I have a primary care physician and the lung transplant team. In addition, I have specialists involved in my care in dermatology, dentistry, cardiology, gastroenterology, ophthalmology, otolaryngology, and urology. My primary care physician and the lung transplant team trade responsibilities depending on my medical situation at any given moment. But I must be the coordinator between them and the specialist. My chart serves as an excellent communication tool for me. I am also arranging all the various follow-ups with the specialists involved in my care. Some of the specialists are associated with the lung transplant team, while others are associated with my primary care physician. As providers, I need your help in making sure everyone associated with my care is knowledgeable about my condition across the healthcare spectrum. In closing, it is my pleasure as a member of a Johns Hopkins Medicine Patient and Family Advisory Council and as a representative of all Johns Hopkins Medicine patients to offer our congratulations to the recipients of this year's awards for clinical excellence. Thank you for what you do for us, your patients, and our families.
Thank you, Podge. That was so heartfelt, and thank you for all that you do for the institution. A number of housekeeping issues before we begin the awards presentation. The first is the individuals from the Armstrong Award for Excellence in Quality and Safety will start to line up over here. The second is, in order to make room for them over there, those of you that are over there, please come to the seats that are available in the front. Third, I want to add appreciation to, as Bill mentioned, the remarkable effort across all the institutions in selecting you all that were nominated by your peers. In addition to the selection committee, I also want to thank the vice presidents of medical affairs from all sites, specifically Dr. Miller, Dr. Blanding, Dr. Zollinger, Dr. Aldrich, Dr. Rothstein, Dr. Romano, and Dr. Brigida Miller from All Children's Hospital. And the final thing before calling up the Armstrong awardees is to really emphasize again the point that Bill made with regard to the videos that have been obtained. You all that are award winners, the teams, you are examples of excellence, clinical excellence. You serve as mentors, both implicitly and explicitly. So thank you for that. And I think these are remarkable examples, remarkable vignettes of what you have to offer our patients, and as importantly, what you have to offer to our physicians in training, our medical students, our residents, and our fellows. So, and also, if you look at your program and follow the photographs, you'll be able to figure out which categories will be coming up next after Armstrong. So be ready, best consulting physician after that. Starting with the Armstrong awardees, which are presented to the physician who partners with patients and families, colleagues, and staff to optimize patient outcomes and eliminate preventable harm. From the Johns Hopkins Hospital, Elizabeth Wick. From the Bayview Hospital, Dr. Geeta Sood. Congratulations. From Johns Hopkins Community Physicians, Dr. Tina Kumra. From Howard County Hospital, Dr. James Zaluki. From Suburban Hospital, Dr. Matthew Leonard. From Sibley Hospital, Dr. Mark Abruzzi. And from All Children's Hospital, Dr. Deepti Amin. Next, I'll ask the award winners in the Best Consulting Physician Award to come to the left. From Johns Hopkins Hospital, Dr. Thomas Trail. From the Bayview Hospital, Dr. David Meyerson. From Johns Hopkins Community Physician, Dr. Daniel Swartz. From Howard County Hospital, Dr. Shatil Waggle. From Suburban Hospital, Dr. Stephen Greco. From Sibley Hospital, Dr. Lawrence Balter. And from All Children's Hospital, Dr. David Berman. If I may ask those that were recognized in excellence in service and professionalism, this award is presented to the physician who actively promotes a culture that embraces, expects, and rewards delivery of patient and family-centered care. For Johns Hopkins Hospital, Dr. Barry Solomon. For Bayview, Dr. Leslie Miller. For Johns Hopkins Community Physicians, Dr. Andrew Lee. For Howard County, Dr. Melinda Canciper. For Suburban, Dr. Dani Westerband. For Sibley, Dr. Andre Sarnia. And for All Children's, Dr. Stephen Kennedy. Next will be the award for clinical collaboration and teamwork. This is presented to the team that engages colleagues and patients in shared decision-making, fostering cooperation, and open communication. For Johns Hopkins Hospital, Dr. Peter McGazel and the Cystic Fibrosis Center team. For Bayview, Dr. Michael Schweitzer and the Center for Bariatric Surgery team. For Johns Hopkins Community Physicians, Deborah Starr. For Howard County, Susan Groman and the Brain Attack Performance Improvement Team. For Suburban Hospital, Dr. Gary Rogan and the pharmacy team. From Sibley Memorial Hospital, Dr. Richard Beckerman. And from All Children's, the patient placement team. The next award is for innovations in clinical care, and this is presented to the physician, nurse, and team that demonstrates a visionary approach to problem solving and performance improvement across the enterprise. For Johns Hopkins Hospital, Dr. Sharita Golden and the glucose management team. For Bayview, Carol Sylvester and the Johns Hopkins Community Health Partnership Care Team, accepted by Dr. Eric Howell. For Johns Hopkins Community Physicians, Dr. Danny Lee. Congratulations, Amy. Nice job. For Howard County Hospital, Dr. Mark Landrum. From Suburban Hospital, Kimberly Kelly, RN, MBA. Congratulations. Okay. For Sibley Hospital, Martin Paul. And for All Children's Hospital, the Hematology Oncology Improvement Team. Our final grouping is the Physician of the Year Award. This honor is awarded to the physician who consistently achieves high standards in the practice of medicine and is looked upon as a role model by their peers. For Johns Hopkins Hospital, Dr. Stephen Schulman. From Bayview Hospital, Dr. Thomas Reifschneider. From Johns Hopkins Community Physicians, Dr. William Convey. From Howard County Hospital, Dr. Nicholas Kutralakis. From Suburban Hospital, Dr. Emirali Nader. From Sibley Memorial Hospital, Dr. Ramin Osqui. And from All Children's Hospital, Dr. Paul Danielson. And I do want to give the opportunity for some late arrivals to come up. Tina Kumra. And I'm told Dr. Landrum has arrived. Is that true? Dr. Leonard.
Well, I think you all agree with me that that's an amazing group of physicians and their colleagues who received these awards tonight. I wonder if you'd join me one more time in congratulating everybody who came out. So I'd like to now introduce the Vice President of Medical Affairs at Johns Hopkins Hospital, Redonda Miller.
Good evening, everyone. Thank you, Bill and John and Jen, for giving me the opportunity to say a few remarks. Wow, you all are an amazing group. Really impressive. Congratulations to all of you. I see many familiar faces in the audience. I see physicians who taught me and mentored me. I see a lot of physicians with whom I work with on current projects. I also see a lot of unfamiliar faces, new faces, and I look forward to meeting you all at the reception. In the spirit of being at Johns Hopkins and honoring clinical excellence, it's hard not to bring up Sir William Osler, the father of modern medicine and our very own first physician-in-chief here at the Johns Hopkins Hospital. Osler was known for changing the way we practice medicine, for modernizing it, for expanding teaching, and for his clinical excellence. He also was not a man who was at a loss for words. He is eminently quotable, and it's really hard not to include one of his sayings in my remarks tonight. But I refrain, and instead, I'm going to quote one of his contemporaries, H.L. Mencken, the sage of Baltimore. He was one of the preeminent newspaper journalists in the first half of the 20th century, and he was known for his acerbic wit and cutting to the point, and perhaps even some sarcasm. He worked for the Baltimore Sun for most of his career, and he did have a few remarks to say about Osler, and I quote, "Before long, interesting news began to filter from the Hopkins. Dr. Osler was solving the problems that the textbooks put down as insoluble. He was ridding the art of medicine of cobwebs and barnacles. He was sending out parties of enthusiastic young men, no women at the time, to explore the medical farthest north and the darkest Africa. He observed things that no one else noticed, and he drew conclusions that violated the league rules. One day, the newspapers became aware of him, and the next day, the public. By and by, the doctors followed." And remember that last part, by and by, the doctors followed. So here's the thing about the master clinicians that we are honoring today. In their own ways, and of course in a much more modern and specialized fashion than Osler, they are doing exactly what Mencken talked about, moving beyond the textbooks, advancing medical practice with clarity, finding new ways of doing things, changing medical paradigms. They are the clinical leaders. These clinicians are also revered not just for their book knowledge, but for the way they deliver their care, with empathy, with compassion, with care. These clinicians work in teams. They honor and respect their interprofessional colleagues, and they work across disciplines. In fact, I would say that these clinicians are what gives Johns Hopkins Medicine the brand of excellence that we have today, and I thank you for that. To bring it back to Mencken's quote, and by the doctors followed. Indeed, that's why we're here today, because we all want to follow in these clinicians' footsteps. Your clinical acumen, your leadership are to be respected, to be emulated, and to be honored. Just for a minute, we should pause and think about all of the medical institutions and practices in the state of Maryland, in Washington, D.C., in Florida. And I would say Johns Hopkins Medicine is blessed to have the cream of the crop, the finest medical institutions and practices. Hopkins Hospital, Hopkins Bayview, Howard County Community Hospital, Suburban, Sibley, All Children's, Johns Hopkins Community Physicians. And then take that one step further and think about how many clinicians, thousands and thousands of clinicians, practice in those institutions and practices. You, the honorees today, are clearly the best of the best. You clearly are. You are the master clinicians and the master teams worthy of the master himself, Sir William Osler. We honor you and congratulations.
Thank you, Redonda. I don't think anyone could have said it better about our honorees. I'd like to introduce Kim Sherbrooke. Kim is the Office of Johns Hopkins Physicians Vice President and Chief Operating Officer. Kim?
First, I want to congratulate each of you on your award. Your stories are special. I had a preview of the videos, so I know how special they are, and I encourage all of you here to go watch those videos in the room, and your commitment to our mission. This is the start of a fabulous new tradition, as my colleagues have said, of recognition of clinical excellence, and will inspire others to go above and beyond, just as you have done. I have the honor to serve as the Vice President and the Chief Operating Officer of the Office of Johns Hopkins Physicians. After nearly 20 years serving in a similar capacity at Indiana University, Hopkins and Baltimore are now home to me and my husband, Jim. I joined the office because of the vision and reputation of excellence of Johns Hopkins Medicine. We have a unique opportunity to impact healthcare in a way that no other institution can, just as Redonda explained. The DNA of Hopkins has and will continue to change the face of medicine. I've been asked to share a few comments about the Office of Johns Hopkins Physicians' strategic direction. It's really quite simple. The vision of the Office of Johns Hopkins Physicians is to create clinical integration among all physicians within Johns Hopkins Medicine, leading to a patient-centered care delivery system anchored in research and education. So what do I mean by clinical integration? Mr. Reed really explained it quite well. It's to manage patient care across the continuum, including provider to provider and provider to patient communication. It's to create a value proposition of highest quality and most cost-effective practice within a robust, geographically dispersed delivery system. Indeed, it is to design and implement evidence-based best practices. So what is our scope? The Office of Physicians coordinates activities of the Clinical Practice Association, our faculty practice plan here, and Johns Hopkins Community Physicians, but also the activities of all physicians now part of or joining the Johns Hopkins Medicine family, regardless of entity or location within Johns Hopkins Medicine. The office exists to ensure that necessary planning committees are put in place, that resources are made available, and that coordination takes place to support Johns Hopkins physicians, and in turn, Johns Hopkins medicine. I am honored and privileged to be part of that journey now. I don't have to tell you what Johns Hopkins means in our industry: excellence, discovery, brilliance, and cure. I would like to share my observations of Hopkins from my fresh Midwestern eyes. I have found it kind, it is warm, it is welcoming. Indeed, it is collaborative, and it has demonstrated an extraordinarily unique desire for collective success. As healthcare is moving rapidly into integrated delivery systems, we have to be facile in finding ways to build bridges and collaboration inside that delivery system. In other words, evolutionary change. Those of you from Bayview may have experienced some of that change in the last couple of weeks, I'm thinking, with Epic. The office will assess areas of need across our enterprise and organize support, such as process improvement initiatives sponsored through the Ambulatory Management Program, which is about to launch the 5th cohort. Performance improvement via our 2016 Ambulatory Key Priorities, focusing on closing encounters, decreasing bump rates, and shortening wait times, as well as advocating for strategic growth through recruitment of identified specialists to improve access to Johns Hopkins care. Spearheading clinical communities and support work to improve population health. Engagement of all Johns Hopkins medicine providers in connecting each part to the whole is critical to our continued success and is a foundational principle of the Office of Physicians. Under the leadership of Dean Rothman, Mr. Peterson, and Dr. Baumgartner, my colleagues and I are enthusiastic to support the faculty, physicians, and most importantly, the patients and families of Johns Hopkins. So the office door is always open, and we look forward to a long and rewarding partnership. Thank you.
I'd like to also recognize Mr. Ron Peterson, who had a commitment that he could not get out of and is here with us today. Ron, I know you're a man who's never lost for words. If you'd love to say a few words, we would love to have you come to the podium, because I know you value clinical excellence as much as anybody in this room. Ron Peterson, President of Johns Hopkins Hospital.
Well, let me just begin by saying that I have valued clinical excellence for many, many years, so it's about time that we are formally recognizing the well-deserved honors that have been bestowed upon our colleagues today. I apologize for walking in late. I had a Garrett board meeting, and I had to preside over that session today, so I do apologize for being late. But what a wonderful turnout. I had the privilege of participating in the All Children's Clinical Excellence Celebration, which I think was our very first several months ago, and so I'm delighted that here we are today at the Johns Hopkins Hospital, and just wanted to take a moment to thank Dr. Rothman for really providing the leadership to really enable us to get this moving in the right direction, and then of course for Bill, who really took the bull by the horns and got us going. So congratulations to all, and I hope to see you in a few moments at the reception. Thank you.
Thank you very much, Ron. I want to tell you all that for me this has been a very exciting evening. It's really, as Mr. Peterson said, we've not done this before, and we should have done it 130 years ago when Dr. Osler was here. I want to just emphasize what Kim said about the Office of Physicians. I've had the pleasure and honor of meeting many colleagues who are in this room from suburban Howard County, All Children's, and Sibley, and of course JHCP. And I have the privilege of being the person who works with the leadership in the Office of Physicians. They're listed right here in the pictures: Steve Kravitz, Paul Scheel, John Flynn, Kim Sherbrooke, and myself. It's really a pleasure, and what she said is true. Doors open. This is, I think, just one way that we can hopefully integrate all of our doctors around a common theme, and that is quality care for patients. So I encourage you to stay for the reception. Please pop in to watch the videos. I think you'll find them to be very special. And I want to thank John, Jen, and Sandy once again for a great way to make this thing start off. Thank you.